that she and her team have been doing.
Thanks, Helen. I'm going to see if my technology works and allows me to share some slides with you all. So let me know if you can see a blue slide.
Yep, there.
Yep, great stuff. So just I've already told you who I am, but a little bit about LPP before we get into it, just to kind of put some context to why we're involved. So we are a not-for-profit member organisation. We're owned by the 35 trusts in London. And historically, we used to provide routes to market like frameworks and dynamic purchasing systems to speed up the route to market for our NHS trusts. And traditionally, we did this in the areas of clinical digital systems, estates and facilities, workforce, so that's things like agency staff and pharmacy. But more recently, and certainly since the introduction of the integrated care systems, of which there are 5 in London, we have been working with trusts collaboratively to try and find more sustainable solutions to some of the problems that present themselves within the NHS. And the sustainability and social value work stream is one of the newer streams that we've created specifically to respond to that kind of doing it once for London ethos. And the social value work that we've been doing is a good example of that. So you'll all be aware of PPN 0620, which is the policy note that describes the requirement around social value. The Cabinet Office produced a social value model to support the policy note, and that focused in on 5 key themes with 8 policy outcomes. And the Cabinet Office are trying to legislate for the whole of the public sector, so the policy outcomes were quite broad, and we were scratching our heads trying to think how we could apply those at a regional and local level. And then helpfully last March, just before the NHS mandated the inclusion of 10% social value in NHS procurements, the Central Commercial Functions Sustainable Procurement Team produced some supplementary guidance, which is focused on the 5-theme model, but slightly reorganized. So they wanted to put a bigger emphasis on fighting climate change, and that was to support the NHS's commitment to reach net zero by 2045, if you include scope 3. They also wanted to provide more guidance around the outcomes, and they had advised some additional NHS health priority areas to give more guidance to procurers. So that introduced things that were specific, like reducing air pollution, reducing consumption and waste, eliminating modern slavery, employing a living wage where possible, and supporting the individuals who were affected by COVID. So we took the guidance, and we then decided that we wanted to have a definition that we could hang everything on. So when we created something, we could go back to that definition and we could test it. And so for us, we wanted to secure the maximum impact against local priorities. So what we needed to do then was identify what our local priorities were. So we took London as a place, and we broke it down into the 5 integrated care systems, which nicely breaks London's 33 boroughs down into specific areas. And we looked at each of those areas in isolation, first of all, to see if we could identify what the inequalities were that existed there that we wanted to impact. So if we look at Northeast London, we know that it covers 7 boroughs and the City of London. We know that it's got a population of 2 million, which is growing, and it's expected to grow by another 250,000 in the next 10 years. We know that it's a really diverse community, and there are 60 different ethnic groups represented in the area. But we also know that it has high levels of deprivation in 5 out of the 8 neighbourhoods, and they sit in the bottom 20% of the index of multiple deprivation. So there are some key areas within the ICS that are suffering from extreme poverty, and 1 in 7 people in Newham are exposed to dangerous level of nitrogen dioxide. So we started to be able to see where the pockets of inequality existed within each of the ICSs, because we replicated the exercise across the other 4. And we came up with a list of priority areas that included things like social inclusion, a need to improve employment opportunities. We needed to support local businesses to kind of create a resilient community. We needed the community to collaborate more on things, and we wanted, of course, to reduce air pollution, which was a common theme across the whole of London. So we had then a long list of inequalities that we wanted to address, and we needed then to identify some measures that we could use to directly impact those. And we used the national TOMs to identify those. So once we identified the measures that we felt best addressed and impacted the inequalities, we then mapped those back to the Cabinet Office 5 theme model so that we could group them into the areas like fighting climate change, COVID recovery, well-being, equal opportunity, and economic inequality. So then we knew we had something that was aligned to both the procurement policy note and also the supplementary central commercial function guidance. But then we got wind that there was a London TOMS that the GLA had worked with the social value portal on. So we mapped it onto that as well to see if there were any additional priorities or objectives that were included in the London-wide TOMS that we should try and include in ours. And I think we picked up 2 or 3 from there as well. And so we then called our product our list the NHS-London TOMS, so as not to be confused with other lists that exist out there. So then we had a list. We wanted to create a toolkit and an approach for our procurers to be able to use the list with effect in tenders that they were publishing. So we procured the social value portal as our recording and tracking tool, and we embedded the list of 55 measures that we had identified into the tool so that they could be used in procurements. And then we set about creating a number of a boilerplate templates. So we have a social value schedule that trusts can complete to meet their requirements. We provided training on how to set up projects in the social value portal, because the way we're using the portal is to self-serve as much as possible. We've recorded a number of supplier sessions so that we can train our suppliers on how to respond to bids that come through. We've developed some evaluator training for our evaluation teams so they know what to look for when bids come through. And we're in the process of developing an onboarding package for our suppliers when they win contracts, and we move their commitments from the procurement module into the contract management module of the tool. So there's a couple of screenshots here just so as you can see what people see when they log into the tool. And if you're interested after this, I can arrange for like a live demo in the tool for anybody who wants to see it in action. But effectively, the first shot there, we set up a project in the social value portal linked to the procurement opportunity, and that then generates a code. So the second box on the left shows what the hyperlink would look like, and then we export that and we place it in the actual tender schedule that's released on our e-procurement tool, which is Atomis. So then a buyer goes into the Atomis tender opportunity. He downloads the documents. And in order to complete the social value part of the bid response, they need to click on the link, which then takes them through to the social value portal. If they've already got an account with the social value portal, they'll see the project come up in their dashboard. If not, they need to register with the social value portal, and then they'll be able to access the project. On the right, you can see what a bidder would do to complete a commitment on the portal. So they would see the list of 55 uh, measures that we have identified, and they'd be able to freely select from that list. And if a tender wanted to put a bigger emphasis on something, like say it was a courier tender, and they wanted to either mandate emission reduction, or they wanted to prioritize it to give it a higher weighting, they could do that. And then the supplier would be able to see that if they picked that commitment, they would receive more marks for it by a multiplication process on the proxy value. Once they then complete the commitments, they then press save, and then that comes back to the portal, where we can download as part of the evaluation process, and then we can evaluate it by checking the evidence that they have uploaded to support the commitment that they've made. And the way we do that is we've split the weighting, the 10% weighting, between a quantitative number and a qualitative description of how they're going to deliver the number. And in most cases, we put a much higher percentage of the weighting to the qualitative, so as we're not disadvantaging SMEs who wouldn't necessarily be able to commit to a high quantity, but have a very good qualitative description of how they would deliver something. So that's how we split the weighting and how we evaluate the bids. The role of LPP in all of this is to administer the tool on behalf of all of the members. We also facilitate the review of the measures on a regular basis to make sure that they remain the priorities for London and for the NHS. We'll continue to provide training for our procurement professionals and our suppliers. And one of the things that we've noticed is that a lot of suppliers are confused between what they're doing as part of their own CSR offer and what they need to provide as part of a social value offer. And the two are different. In the policy note, it states that the social value must be additional and specific to the contract. So the fact that a supplier supports a particular charity can't be used as part of their social value evidence. They need to show what they will be doing in addition on our contracts in our communities to make it compliant in terms of the social value offer. Sitting at the top with an overview of everything that's happening on a single system, we're able to share best practice and social value insights from the system. We'll be able also, once we have enough data in the system and enough projects moving through to contract administration, to track and monitor the realization, and we'll be able to do things like show where suppliers aren't uploading data, so we can go back to trusts and say, you may want to have an intervention with this supplier because they haven't uploaded any evidence for the last quarter or the last 2 quarters. And then, because we feel like the realization of the data is the much more important part of the process. It's easy to make a commitment, it's much more difficult to deliver on that. And we will be providing insight reports and position reports for trusts and ICBs at regular intervals going forward, so they can see where they are against those delivery targets. And then just a couple of insights. The tool has been up and running since last April. We have 37 active users on the tool. We have 42 projects in the tool. 25 of those are live. 17 are either at evaluation or award stage. and we've just moved our first 3 projects into contract management. So in the next quarter, we should be seeing some supplier evidence being uploaded against the commitments that they've made. And the categories for contracts that we've seen coming through are in construction, FM, which you would expect because the suppliers in those areas are, much more used to social value, having worked with local authorities on this for a long time. But now we're starting to see IT hardware and software contracts come through. We've seen 5 transport contracts, and that's from the very niche non-emergency patient transport category right through to taxis and couriers. And we're also seeing commissioned health services come through. So it's just showing that there's a wide variety of areas where we can extract social value. And before I finish, I just thought I'd share some of the learnings that we had on our journey. And we're very aware that even though we've been at this for 9 months, we've only taken our first steps into what is effectively a marathon. And, we still have a lot of learning to do. But the important points are that it's not a procurement responsibility. Procurement is just the enabler at the end of the process. We need to be thinking about social value much more early in the commissioning process. So when somebody's starting to think about needing a service or needing something, that's when they need to start thinking about how we're going to affect social value. We also need to increase our awareness of social value throughout the organisation. So we've just commissioned HACT, who are a social housing charity, to develop a briefing webinar series for our board and committee members so that social value is understood from the top down. And also training suppliers is as important as training our buyers. And we're now investing in a lot of time to ensure that we capture as many suppliers as we can, so that they understand what is expected of them when they see a social value requirement in a tender. The other thing that's really helped us is that we've had a lot of support from the London Anchor Institute, and it's been great to kind of be able to share stories and get support from the other anchors in the network. We're also now just about to start developing some case studies to dispel the myths that social value costs. And we have seen some really good social value offers come through that have been based on suppliers' existing resources and expertise. So we've seen like legal firms just doing pro bono legal services to a community centre. And we've seen a courier company offering to transport food from supermarkets to a food bank, and so that doesn't cost them anything. They have the expertise already, and they have the resources. It's just using our contracts to leverage that expertise and that resource and direct it in the place that it's needed most. And then my final point is that there's nothing wrong with starting small. I mean, it's taking us months to get to this point, but when we wanted to test some of our theories out, we found some trusts who were happy to support us and just do one small tender to test it and see if it worked. And that's really helped us. So thank you. I'm going to leave it there and stop presenting. If there's any questions, I'll happily take them.
That was brilliant. Thank you so much, Michelle. It looks like you've got a really, really thorough, well thought out end-to-end process, and I think there's a lot there that we can all learn from, particularly us in the Met. We do a lot about getting it up front, but we're not so good at actually how we measure and capture and monitor what our suppliers are doing. And looking at the social value portal is something that we've been thinking about for a while, but we haven't actually sort of got it over the line. So that's been brilliant. So really clear and really, really helpful. Thank you. There are a few questions that have come up in the chat. So Gordon, I know you were asking about how sort of the social value portal impacts on SMEs and whether